All right, so let's go over the ATI fluid electrolyte and acid base questions. Um, okay, let's start off with this.
A nurse is assisting in the care of a client who has heart failure and a prescription to receive a unit of packed red blood cells. The nurse should plan for the blood to infuse over which of the following lengths of time? A. 1 hour. B. 2 hours circa 4 hours. D.
Okay, so a nurse is assisting in the care of a client who has heart failure and a prescription to receive a unit of packed red blood cells. The nurse should plan for the blood to infuse over which of the following lengths of time? Is it A, 1 hour, B, 2 hours, C, 4 hours, or D, 6 hours? So the answer is C, 4 hours. The transfusion should be administered slowly, the max time of 4 hours to avoid increasing the workload of the heart. Okay, let's go on.
C. Verify the unit of blood with another nurse.
Okay, so a nurse is assisting in, I wonder if I press like this.
C.
No, it's not. So a nurse is assisting in the care of a client who has a prescription to receive 1 unit of packed red blood cells. The client's blood type is AB positive, and the nurse receives a unit of A negative blood from the blood bank. Which of the following actions should the nurse take? Is it A, return the blood unit as it is not compatible with the client's blood? B, stay with the client for 15 minutes prior to starting the blood transfusion? C, verify the unit of blood with another nurse? Or D, prime the blood tubing with 0.45 sodium chloride? So the answer is C, verify the unit of blood with another nurse. They try to trick you over there where it said like stay with the client for 15 minutes prior to starting the blood transfusion, but it's after, not prior. We do prime the blood tubing, but not with 0.45%. That is a hypotonic solution. But yeah, it needs to be, we need to ensure that the blood unit has been verified by 2 nurses before initiating the transfusion. Okay, so a nurse is assisting an RN. Let me see if I can play this.
D.
Okay, so a nurse is assisting an RN who's preparing to start an IV for a client who has high risk for bleeding. Which of the following actions should the nurse take? Is it A, apply a cold compress to the selected IV site? Ask the client to hold the extremity up prior to searching for an IV site? Ask the client to spread their fingers of the selected extremity, or apply a blood pressure cuff set to 300 millimeters of mercury. So they have a high risk of bleeding. We're not going to use a cold compress, okay? We're not trying to close the vessels. We don't ask them to, hold their extremity up. What's the point of spreading their fingers? It would be to apply a blood pressure cuff set to 30 millimeters of mercury. This helps protect the client's extremity from bruising and bleeding. It's better than using a tourniquet, because the tourniquet can be too rough for some clients. So, all right. A nurse is caring for a client who's receiving treatment for hyponatremia. The nurse should identify that which of the following findings is an indication that the treatment has been effective. The client states that their muscle spasms are absent. The client reports a headache. The client denies being confused. The client reports being nauseated. The client reports feeling tired. So I'm guessing A, the muscle spasms are absent. C, the client denies being confused. And the client reports, okay, I think that's the only 2. Okay, yeah, the client states that their muscle spasms are absent. And C, the client denies being confused. So the absence of muscle spasm and client reporting that they are not confused is an indication of adequate sodium levels, because when you have hyponatremia, what happens is that usually there's more sodium outside of the cell, but with hyponatremia, there's going to be less sodium in the blood. So there's going to actually be more sodium inside of the cells, and water loves sodium. So what's going to happen is that water is going to go into the cell itself and like puff it up, which can lead to cerebral edema. So a nurse is assisting in the care of a client who has an acid-base imbalance and is experiencing hypoxia. Which of the following actions should the nurse take first? So is it A, initiate continuous cardiac monitoring, B, elevate the head of the client's bed, C, instruct the client to deep breathe and cough, D, initiate continuous SpO2 monitoring? So look at the question. We know that they are experiencing hypoxia. What is hypoxia again? Hypoxia is a condition where tissues in the body do not receive enough oxygen. This can happen for several reasons, and it can affect the entire body. What is the difference between hypoxia and hypoxemia? Hypoxemia refers to low levels of oxygen in the blood, so emia. Okay, so hypoxemia refers to low levels of oxygen in the blood, particularly in the arteries. Causes would be like lung diseases like pneumonia, COPD, asthma, or pulmonary edema. High altitudes, hypoventilation or slow breathing, airway obstruction. Hypoxia is a broader term that refers to insufficient oxygen supply to the body's tissues, regardless of the oxygen in the blood. So there's different types of hypoxia. Sorry, I know. Hi. Hypoxia, it says, caused by low blood oxygen levels. Anemic hypoxia, reduced oxygen carrying capacity due to low hemoglobin levels. Circulatory hypoxia, which is poor blood flow, causing inadequate oxygen delivery to tissues. And histotoxic hypoxia. Cells are unable to use oxygen properly, often due to toxins. Sorry, I needed to know that. Okay, so the first thing that you're gonna do is, I'm saying elevate the head of the bed because like that's something you can do immediately, and it is. So elevate the client of the head of the client's bed. Rationale: the first action the nurse should take when using the airway breathing circulation approach is to client care to elevate the head of the bed. Placing the client in Fowler's or semi-Fowler's position will promote effective breathing and chest expansion. Okay. So a nurse is collecting data on a client who has been receiving IV therapy for several days and notes that the client's daily weight has increased. The nurse should identify that the client is at risk for developing which of the following IV complications. What are you doing? What? What? Look at this guy. Thank you guys for giving him. Thank you everyone for bringing my study buddy here. I need to have one physically, okay? So I can hold and hug. Okay. Okay, so a nurse is collecting data on a client who has been receiving IV therapy for several days and notes that the client's daily weight has increased. The nurse should identify that the client is at an increased risk for developing which of the following IV-related complications. Okay, so collecting who has been receiving IV therapy for several days and notes the client's daily weight has increased. The nurse should identify the client is at increased risk for developing which of the following IV complications. Hi. Phlebitis, extravasation, air embolism, or circulatory overload. So it would be circulatory overload. The nurse should identify that the client who has been receiving IV therapy and whose daily weights. Are you here to help me? Please and thank you. Well, please continue helping me, please. I need to get through this program so I can help others, okay? That's all. I don't need a title. I just want to help others, and in doing so I can help myself too. So we'll help, okay, be of service. That's all, okay? So help me understand this, please. Stay focused, stay motivated, stay grounded, stay stable, have fun through the process, and help others. That's all. Spiritual goals and scientific goals, if you like to say that. You know, both. Help teach, help share. Yeah. Thank you. Thank you. I'm honored. I am honored. I am thankful. Very grateful. Thank you. Thank you. Oh, I'm crying here. Okay. Just talking with the flame, it's fine. And with my guys. Okay. So it's circulatory overload. Other indications of circulatory overload include tachycardia, because you know the heart is working harder because of the increased fluid, increased BP, edema, cough, and tachypnea, so breathing faster. So a charge nurse is observing a newly licensed nurse who is preparing to administer a blood transfusion to a client. For which of the following actions by the newly licensed nurse should the charge nurse intervene? So I don't think this is a select all that you apply. So the nurse selects a 0.45% sodium chloride to use to prime the tubing. Mele! Stop with that noise. The nurse asks another nurse to check the blood unit label and client identification prior to beginning the transfusion. The nurse uses tubing with a filter for the blood transfusion, and the nurse discards the tubing after the first unit of blood is completed. So, like I said, the 0.5% is a hypotonic solution. We don't want a hypotonic solution when we prime the tubing. Okay, we want a 0.9 or lactated ringers. So it's going to be a... Okay, the nurse should identify that 0.9% sodium chloride is the only IV solution that should be used to prime the tubing for blood administration. So a nurse is caring for a client who has a peripheral inserted central catheter, or a PICC. For which of the following complications should the nurse monitor? A, the need for multiple IV sticks. B, infections at the access site. C, dehydration, or D, infiltration. Which of the following complications should the nurse monitor? For me, I would say it would be B, infection. Okay, so infection at the access site. So the nurse should monitor the client who has a PICC for complications such as infection at the access site and blood clots. It is important for the nurse to use aseptic technique when assessing and flushing the PICC line and during dressing changes. So a nurse is prepping to administer 4,200 milliliters of intravenous fluid to a client to infuse over 24 hours. The nurse should set the IV pump to deliver how many milliliters per hour? Okay, this is just, we don't need to do that part. Okay, so a nurse is preparing to administer, let's see. Oh, so it's another thing. Oh, yeah. Yeah, but basically it says on there, so 4,200 milliliters divided by infusing 24 hours, so it's 175. The same thing over here, 1,950 over 13 hours, so that would be 150. So I think this is the same thing. They want us to do math. This is like, okay, so a nurse is calculating a client's intake and output for the last 4 hours. The client consumed 480 milliliters of water and 240 milliliters of coffee. The client also received IV fluids, that is, so you just add all of them up. That's it. Okay. So a nurse is assisting in the care of a client who requires a replacement peripheral IV. The client is dehydrated and requires a smaller gauge catheter than the 20 gauge being replaced. I didn't know that. So if you're dehydrated, then you might need a smaller gauge than the 20 gauge being replaced. Which of the following gauge catheters should the nurse recommend? So the higher the gauge, the smaller. So it'd be 22, right? Yeah. Okay. So a nurse is caring for an older adult client. Sorry. A nurse is caring for an older adult client who's experiencing dehydration. The nurse identifies that which of the following factors increase the risk for dehydration in older adult clients. Which should identify which of the following factors increase the risk for dehydration? Dehydration. It would be select all. So decreased kidney function, decreased thirst response, decreased total body fluid. Oh my God, eating watermelons and eating cucumbers with each meal. So it would probably be A, B, and C, but if I only, it would probably be like A and B. Oh no, it is A, B, and C. Okay. Decreased kidney function, decreased thirst response, and decreased total body fluid. So the nurse should identify that an older adult client who has decreased kidney function, decreased thirst response, and decreased total body volume is at risk for dehydration. Okay, so a nurse is participating in a blood drive and is taking a donation from a client who has my blood, which is O positive blood. The client asks the nurse what type of blood they can receive. O positive. Which of the following statements should the nurse make? Okay, so what we can get is O positive and O negative. And that's pretty much it. So you can receive a blood donation from donors from O negative and O positive. I think that's it. Yeah, that's true. So clients who have O positive blood can only receive blood from donors who have O negative or O positive blood. Okay, so a nurse is collecting data from a client who's exhibiting signs of fluid and electrolyte imbalance. Which of the following reports from the client is an indication that they have a fluid or electrolyte imbalance? Oh, this is, well, we know this one. The client reports working in a warehouse. I think it's like the client reports that they perform yard work for 8 hours in 95-degree temperature. So yeah, that's it. Let me keep looking at ones that I think are good. It's always this one for me. So a nurse has completed collecting data for a client who has an acid-base imbalance. That means they did the assessment already. So which of the following steps of the nursing process should the nurse take next? So they collected data. So you have ADPI, which is so we have A, implementation, B, recollection of data, C, evaluation, or D, planning. Okay, so the only one that makes sense would be planning. So after assessing and analyzing data for a client who has an acid-base imbalance, the nurse should move into the planning stage of the nursing process and establish goals and outcomes for the client. Hypovolemia. Let me go pull this up real quick. Hold on. Okay. Hypernatremia, hypokalemia, hypervolemia. So a nurse is caring for a client who is experiencing hypovolemia. Which of the following findings should the nurse identify as the priority to report to the provider? So yeah, it would be decrease in level of consciousness. We know the levels, right? Yeah, we know the levels.
Sorry.
Can you close my door, please?
Sorry.
This is the hypomagnesemia question she probably might use. So a nurse is receiving a report on 4 clients. The nurse should identify that which of the following clients might be experiencing hypomagnesemia. So A, a client who has vomited 4 times during the last 8 hours. B, a client who requested an extra breakfast tray to eat. C, a client who can ambulate without assistance. D, a client who reports extreme thirst. So for hypomagnesemia, the answer is actually A. So a client who has vomited 4 times during the last 8 hours, hypomagnesemia. So if you think about it, magnesemia makes your smooth muscles like chill. Hypomagnesium would be like the opposite of chill. So you're going to have cramps. You're going to have, it's going to be cramping, right? So a client who has vomited 4 times during the last 8 hours. So rationale, nausea and vomiting are early manifestations of hypomagnesemia. Other manifestations of hypomagnesemia include decreased appetite and weakness, which could make it difficult to ambulate. Extreme thirst is a manifestation of hypernatremia. Okay, so if a client is vomiting and having diarrhea, what kind of IV solution do you think you'll be having? What would the body be going through? It would be dehydrated, so you would be low in fluids and high in solutes. So you would need like a hypotonic solution, right? And that is going to be like 0.4, like lower than 0.9, because 0.9 is like lactated isotonic. So let's see. Okay, that would be 0.45 then, right? Oh no, it's saying that, oh my god, good thing we're going through it. Okay, so it's saying 0.9 sodium chloride solution. So a 0.9% sodium chloride solution is isotonic and used for hydration needs such as from vomiting and diarrhea. 0.45 sodium chloride solution is hypotonic and used to treat hypernatremia and DKA. My bad. So 0.45, we are using that for DKA and hypernatremia. Dextrose 10% is used to treat hypoglycemia. .3% sodium chloride solution is hypertonic and used for emergent replacement solutes experiencing manifestations of hyponatremia. Okay, so a nurse is reviewing. I don't think, why would we need to know this? There's no IV solutions on here. This is all blood gas stuff. Okay. That's pretty much it for the questions.